Good day to everyone. I am Nicole Angelou Serrano Aranda, and today I'm going to demonstrate to you how to assess the thorax and the lungs. So first is to assemble our equipments before preparing our client. So the first thing that you should have is our stethoscopes. Stethoscope is used for auscultation. And next is we have our wet cotton balls to wipe the earpieces of the stethoscope, and we have our alcohol for aseptic technique, our mask, a washable marker, and a gloves. This glove is used for the palpation of the surface characteristics of the lesions, if there is. And of course, we have here our centimeter rule. So that's the equipment we will be needing in the assessment of the thorax and lungs. And now is to proceed to our client, introduce who we are, verify client's identity, explain what we are going to do, why is it necessary, and how the client can cooperate. Good day, sir. I'm your nurse for today. I'm a student nurse from St. Mary's University. I am Nicole Aranda. So may I just know what is your name, sir?
My name is Nico Jamie Binangan.
Okay, so may I just look at your name tag? Okay. So in this assessment of the lungs and thorax, all I am asking you to do is to remove your clothing and for me to palpate and inspect it accurately, okay?
Okay, ma'am.
Okay, thank you, sir. And then, next is to ask the client to sit in an upright position while his hand is at the side. Okay, so sir, umupo lang po tayo na maayos. Thank you, sir. And then encourage your client to ask questions and to call your attention whenever he feels any discomfort or pain. Okay. So, sir, meron po ba kayong questions before we start? Okay, sir. All I'm asking you to do is to call my attention whenever you are going to feel any pain or discomfort. Okay?
Okay, ma'am.
Okay, and of course, as a nurse, you should remain non-judgmental regarding the clinical habits of the client and the lifestyle of your client. Okay, next is perform appropriate hand hygiene procedure and other appropriate infection control. So, sir, I just did my proper hand washing a moment ago. So, I'll just put alcohol for aseptic technique for us to be safe. Okay? So, next is to provide clients privacy by closing the curtain. And especially this procedure because we are going to expose the upper extremities of our client. So, let's close our curtains. Okay? And then, next is to make sure that the room temperature is comfortable with the client. So, because in this procedure, the client will take off his shirt, so baka lamigin siya. So, make sure to adjust the room temperature or the aircon. Okay? And then next is make sure that your hands is warm so that it is warm to touch for the client. Okay? So, now we proceed to the preparation for the client. Okay? So, first preparation for the client, have the client remove any clothing from his waist up. Okay, so tanggalin na po natin yung clothing. Okay, then next is to explain to the client why is it necessary to expose the entire chest during the examination. So, sir, I need to ask you to take off your clothing because I need to expose the entire chest for me to inspect and palpate it accurately to have a result that is correct. Okay?
Okay, ma'am.
Thank you, sir. And then next, after preparing your client, we now good to proceed with the general assessment. First is the inspection. So inspection is using our sight, sense of sight. So first is to inspect for any nasal flaring or nasal flaring and lip pursed breathing. Okay? So, sir? Okay. So far, ang ating client, wala naman siyang nasal lip breathing. So, normal ang kanyang paghinga. And then, next is to inspect for the client's facial color, the color of his face, the lips, and the chest. Okay? So, upon inspection, I can see that his face color is normal, while there is no any evidence of pallor. And yung kanyang lips is normal, reddish, and hindi naman siya, there's no any crack or hindi siya nag-white. Okay? And then sa chest niya, okay, there's no any swelling or redness. Okay? So, next that we inspect is the client's or patient's nail color and shape. Okay, may I have your hand, sir? So, I'm inspecting your nail beds. So, it's normal, it's pink. The shape of your nail is normal. So, let me just check your capillary refill, okay? Okay, your capillary refill is normal, sir, because it goes back to its proper color, which is pinkish, to 1 to 2 seconds. Okay? So, next, after that inspection, we now proceed to the posterior thorax, the inspection of the posterior thorax. Okay? So, first thing to do is, okay, sir, pwede po bang kayang patalikod? Alak. Okay. So, katulad pa ng kanina, sit upright, put your hands at your side. Okay? So, the assessment of the posterior thorax, first is to inspect for any configuration. Note for the position of the scapulae and the shape and color or configuration of the chest wall. Okay? So, the scapula is symmetrical upon inspection. Okay? And then, the chest wall is normal. Okay. So, it's all normal. And then, next is we assess the use of accessory muscles for breathing. Okay? So far, ang kanyang breathing pattern is normal. There's no use of accessory muscles. And then, next is to inspect or to note client's positioning and the ability to support his weight while breathing normally or comfortably. Okay? So, upon inspection, I can see that the client is able to support his weight while breathing comfortably or comfortable, and that is normal. Okay? And that's the inspection of the posterior thorax. Now we proceed to the next procedure. Okay? Okay, the next thing that we should do in our assessment of thorax and lungs is the palpation. So in palpation, we use our sense of touch. Okay, so we palpate for tenderness and any sensation. Palpation may be used by one hand or by both hands depending on the nurse choice. Okay, so in this procedure, sir, I'm asking you to just call my attention when you are in pain or when you feel any discomfort. Okay?
Okay,
Okay, let me start my palpation. Is there any pain?
Nothing, ma'am.
Okay, how about here?
Nothing, ma'am.
Okay, here.
Nothing, ma'am.
Okay, here.
Nothing, ma'am.
Okay, here.
Nothing, ma'am.
What here? Okay, here.
Nothing, ma'am.
Okay, and for the last.
Nothing, ma'am.
Okay. And then next is we palpate for crepitus, or also called as subcutaneous emphysema, sir. Okay? So just like what I did a moment ago, the sequence is the same, but this time I will just palpate the crepitus. Okay?
Okay, ma'am.
Okay. Next, sir, that I'm going to do is to palpate the surface characteristics. If there is lesions on the inspection, this is the procedure that we should do. But since in my inspection, there's no any lesions, so we skip that procedure, okay? So, next is to to palpate the the fremitus, okay, of our client. So, following the sequence described previously, use the ball or ulnar edge of our hand. So here we ask our client to say the word 99, okay? So sir, as my palpation, say the word 99, okay?
Okay, ma'am.
Okay. Say the word
99.
Okay. Say the word again.
99.
Okay, say the word again.
99.
Okay, and again.
99.
Okay, again, sir.
99.
Okay, thank you. And then next is to assess chest expansion using our thumb. Okay, so we assess the chest expansion using our thumb. So let me just look at it, sir. Can you please sit properly? Okay, let me just look at it. Okay. So here, sir, I'm asking you to take a deep breath. Okay, inhale and exhale. Okay, inhale, exhale. Okay, inhale, exhale. Okay, and inhale and exhale. Okay, let me just assess it for me to have an accurate result. Okay, so inhale and exhale deeply. Okay, inhale. Okay, exhale. Inhale. Okay, just continue the process, sir. Okay. As per my palpation, as my thumb moves symmetrically, so the chest expansion is normal. Okay. Next is we proceed to the percussion. So first is percuss for tone. Start from at the apices of the scapulae and percuss across the top of both shoulders. Okay? Okay. Next is to percuss diaphragmatic excursion. So we use our marker here and our centimeter ruler. So here, sir, I'm going to use my washable pen to know the diaphragmatic excursion. So all I'm asking you to do is to inhale and exhale deeply, and then as I said this word, hold you stop or you hold your exhalation or inhalation. Okay?
Okay, ma'am.
Okay, sir, so you should inhale. Okay, exhale, inhale, exhale. So sir, pwede pa ba umayos ng pag-upo? Okay, okay. So ulitin lang po natin. Okay, inhale, exhale, inhale, exhale. Okay, hold. Okay, you can continue breathing, sir. Okay, so inhale, exhale, inhale, exhale, and inhale for the last time and hold. Okay. Okay, you can now continue inhaling, sir. So I'll repeat here at this side, sir. So the same procedure. Okay, inhale, exhale. Okay, can you please sit in a proper position, sir? Okay, inhale, exhale. Okay, and then hold. Okay, you can continue breathing, sir. Okay, inhale, exhale. Inhale and then hold, sir. Okay, you can now breathe properly. Okay, let me just measure it, sir, to know that they are symmetrical using my centimeter ruler. Okay, okay, so they are symmetric. Okay, next is our auscultation. Okay, so we auscultate breath sounds, and then at the same time we while doing the auscultation of breath sounds, well, we now do it with the auscultation for the adventitus sounds. Auscultate for voice sounds such as bronchophony, egophony, and whispered pectoriloquy. Okay? So, we use our stethoscope. Okay? Okay, all I'm asking you to do, sir, is to use your mouth. Use your mouth in breathing, sir. Okay? So, use your mouth in breathing. Inhale and exhale using your mouth.
Okay, ma'am.
Okay. Deep breathing, okay, sir? Okay, wait na po. Okay. Start. Okay. 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 Okay, thank you, sir. Okay, so that's our auscultation, sir. Now we proceed to the anterior thorax. I'm asking you to move anteriorly. So, mag-move lang po tayo. And here is the inspection. First is I will inspect your configuration, shape and configuration. And next is I will going to inspect for the position of the sternum. Okay, so pwede po ba tayong humarap na lang po? Pwede po ba tayong sir po na maayos? Upright position po ulit with your both hands at the side. Okay, relax lang po. Okay, so katulad ng sinabi ko kanina, shape and configuration, normal. Then the position of the sternum, normal. Okay, so upon inspection, we do the palpation, our sense of touch using our hands, one hand or both hands. So can you just sit properly again, sir? Okay. So let me just feel if you are want to touch. Okay. So your body temperature is normal, sir. I will palpate already. Okay, are you just call my attention if you feel anything. Okay.
Okay, ma'am.
Okay, so the next is there's no any tenderness, there's no any surface masses. So next is you palpate for tenderness of costochondral junctions of the ribs, and as well we palpate also for the crepitus as we do on the previous steps. Okay, so palpate lang po natin ulit, sir. Okay. And then, upon my palpation, there's no masses or there's no swelling. And then, next is we palpate for surface masses or lesions. Okay, so, the surface characteristics, there's no any, upon my inspection, there's no any lesion. So, we skip that procedure. But if there's any lesion, is we palpate the surface characteristics of that lesion. Okay? And then, next is palpate for fremitus. Okay, so sir, katulad po lang ginawa natin kanina sa likod ninyo, just say the word 99, okay?
Okay, ma'am.
Okay, so say the word 99, please.
99.
Okay, can you repeat please, sir?
99.
Okay, thank you. Say it again.
99.
Okay, say it again.
99.
Okay, say it again.
99.
Okay, say it again.
99.
Okay. And then next is palpate for the anterior chest expansion. Okay? So, I'll just locate, sir. So, using my thumb again. Okay. Inhale and exhale deeply. Okay, sir? So, just continue the process. Okay? So, Okay. Okay. Okay, last one. Okay. As you would see, my thumb moves symmetrically. So the chest expansion of my client is normal. Okay. Now, we proceed for the percussion. So, in the percussion, percuss the apices above the clavicle. So, this is the clavicle of my client. And then, percuss the intercostal spaces and down to the and down and then comparing size. Okay? So, ipapercuss ko na po. Percussion na po tayo. So, okay. And then next is we auscultate using our stethoscope. So I'll just wipe it with my cotton ball. Okay, and then in auscultation, we auscultate the anterior breath sounds, the adventitus sounds, and the voice sounds. Okay, we auscultate from the apices of the lungs and slightly above the clavicles to the bases of the sixth rib, and ask the client to breathe deeply through the mouth. Okay? So, sir, in this auscultation, I'm asking you again to breathe using your mouth, okay?
Okay, ma'am.
Take a deep breath on your mouth and inhale and exhale, okay?
Okay, ma'am.
Okay. 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 Okay, thank you, sir. Next. Okay. Okay, can you repeat it again, sir? Okay. Okay. Okay, for the last time. Okay, the last time, sir. Okay. Thank you, sir. So that's the auscultation process. Thank you, sir, for cooperating.
Okay, ma'am.
So, you can now wear your clothes. Okay. Thank you, sir.
You're welcome, ma'am.
Okay, so the last thing that we do is that we document any result regarding the assessment of the thorax and the lungs. So, basing on the examination or the assessment from inspection, palpation, percussion, and auscultation, my client has a normal respiration, breathing pattern, and in regarding to the assessment of the thorax and the lungs, it's all normal. Okay, so these are the things that I will document on my findings. Okay, so thank you for watching.